Hello everyone, welcome back. I am Sandusky Chiropractor Dr. Steve Prentice, and today what we're going to talk about are herniated discs. Now this is a big topic because if you have one of these, you're not enjoying life. They can be miserable to say the least. And the biggest thing I want to communicate with you today, one of the biggest things is, if you are diagnosed with a herniated disc, it does not mean that you are required to have surgery or more invasive procedures. Sometimes the implication is given to people that, well, if you have normal back pain and it's severe, that's one thing, but if it's a herniated disc, then you're a surgical candidate only, or you need injections or something invasive, and that is simply not the case. I've been treating, and all chiropractors will treat people with herniated discs. I've been doing it for 16 years, and I can tell you that the number of people that have come into our office with herniated discs that I've had to refer out for surgical consults is very few, probably less than 12 in 16 years, which means the vast majority of people that have herniated discs get treated successfully with chiropractic. Now I know that if you've had a herniated disc and it's flared up, whether it's in your neck or your low back, then you might be a little leery about having someone apply a lot of force to you, and I totally get that. That's why when you come into our office, we will use the absolute minimal force necessary, and sometimes, quite frankly, we can just do a little bit at the beginning because that's all the patient can tolerate. So we always want to stay in the comfort level of the patient. And then as the patient can handle more, we can do more to get them to come out of the flare-up. But nonetheless, there's nothing to be afraid of as far as the treatment, actually receiving an adjustment if you have a herniated disc. There's no danger to that. It's very clear when it's time to go to surgery. And so all chiropractors, including me, are aware of that and know when to send you out for a surgical consult, so you don't have to worry about that either. Just want to express to you that when you have a disc herniation, it's more than likely you have a vertebral subluxation, which is a misalignment of the vertebrae that puts torque and torsion on the disc, which makes it bulge and press on nerves, and that's what gives you that nerve pain. Well, you got to get that vertebral subluxation corrected, otherwise you're going to be struggling with these disc problems or these herniated disc problems for a long time. So I want you to get checked by the chiropractor to make sure that you're getting the subluxations corrected as you're treating for these disc flare-ups. And again, I want you to understand also that a herniated disc diagnosis does not mean that no one else can touch you and that it's unsafe to do anything with you other than surgery. Please don't buy into that logic. Again, if you have any questions, call our office or go to our website and shoot me an email. I'd be happy to get back to you with some answers. Thank you for joining us today, and stay tuned for our future videos where we'll tackle other topics.